Hello, and welcome to today's webinar. This is Jessica Solomon-Fisher, the Chief Innovations Officer for the Public Health National Center for Innovation. Welcome to our second town hall for the Futures Initiative. We very much appreciate your joining. This is the second of 3 virtual town halls that we'll be doing, and we just wanted to share a few logistics before we get started. Everybody is muted, and when we get to the discussion portions, we will unmute your lines one at a time, only if you raise your hand to speak. So you can see in your kind of instructions on the side of your screen that you have the ability to raise your hand. So if you'd like to chime in during that portion, please raise your hand and we'll be happy to call on you. I will note that in order to speak, you'll also have to have entered your audio PIN. So be sure to do that, and that's also found in that box on the right-hand side of your screen. Otherwise, even if we call on you, we won't be able to hear you. For those of you who want to participate but don't want to participate verbally, you can also use the chat box and type in questions or thoughts, and we will address those as well. And finally, we'll be using polling software later on to collect feedback, so be sure to stay close to your phone or computer, and we'll give you instructions at that time. We are recording this town hall, and we'll make it available publicly afterward. And a final note on logistics, this is a pretty large webinar, so we'll do our best to make it work to have a discussion. Having a discussion with a couple hundred people over the phone is a little challenging. So we've adjusted our logistics and how we're going to do the call in terms of raising the hand and using the chat box. However, if it becomes too distracting, then we'll have to move to taking questions only through the chat box. But rest assured that we are recording this and your feedback will be taken both through the live polling and however you choose to share it, whether verbally or through the chat box. We will hear you. So you can see our agenda on your screen. We'll do welcome and introductions to both PHNCI and our partner, the Beaumont Foundation. We'll talk about the purpose and overview of the Futures Initiative, a little bit on the history of the essential public health services, and then really talk about your feedback, hearing from you, and discussion before we go into next steps. So with that, if we move to the next slide, I'll just give you a little bit of an overview of who PHNCI is. We are the Public Health National Center for Innovation. We are a division of the Public Health Accreditation Board, or PHAB, and we really strive to empower health departments to drive change and improve health through innovation. So we are approaching our 4th birthday and really see ourselves as the go-to resource for ideas, inspiration, and tools to spark public health innovation in communities. Everything we learn feeds back into PHAB and the accreditation process. And we've learned a lot in our 4 years of existence and are just really excited to be a part of this effort, which you'll hear more about in just a few moments, in partnership with the Beaumont Foundation to take a look at the 10 essential services and all that they have meant and continue to mean to the field, and how we might want to revise those based on your feedback to ensure that they stay relevant for public health practice in the future. So with that, let me turn it over to our funding partner, Katie Sellers from the Beaumont Foundation.
Hi, everyone. I am so excited to see the turnout for today's webinar, and I really appreciate you all investing a piece of your time in this initiative. I wanted to start by just giving you a sense of who the Beaumont Foundation is, in case you don't know. The Beaumont Foundation was founded by someone named Pete de Beaumont. He was a mechanical engineer who developed practical tools. He launched a company called Brookstone, which at the time sold practical tools like dental clamps and dovetail saws through a catalog. Back then, it didn't have outlets in airports, and it didn't sell massage chairs and neck pillows. And he retired in 1980 and sold it to the Quaker Oats Company. He made some money on the sale, of course, and used those funds to start the Beaumont Foundation in 1998 with a mission to improve public health. So today, our mission is to advance policy, build partnerships, and strengthen public health to create communities where people can achieve their best possible health. Next slide, please. So a while back, we noticed that the 10 essential public health services were reaching their 25th birthday. And we thought about all the things that have happened in the last 25 years that have had a major impact on public health and our nation more generally. Things like September 11th, which changed the way we think about emergency preparedness and response, the Master Settlement Agreement, which gave us a new way to approach corporate responsibility, globalization, the smartphone, school shootings, marijuana legalization, informatics, Obamacare, major demographic shifts, and public health accreditation. Well, accreditation may not be as big in terms of a cultural shift in America generally, but it is really important in terms of how we do public health. So we were thinking of everything that had changed and all the things that could change in the next 25 years. No doubt, lots of things we can't even conceive of right now. And we decided it was a good time to take a look at the framework. In a lot of ways, the 10 Essential Public Health Services is a practical tool. And so much of what we do at Beaumont is to convene people to get the best ideas to use to strengthen the public health system. So PHNCI seemed like a really natural partner, an organization that is driving and supporting innovation, that's looking ahead and trying to make sure health departments are going to be able to address what comes next. Their association with the Public Health Accreditation Board, which of course has standards and measures that are based on the 10 Essential Public Health Services, also made a lot of sense to us. So we worked with PHNCI to put together a task force that could guide this futures initiative. We invited a diverse group of leaders representing state, local, and federal public health, non-governmental public health, foundations, academic institutions, nurses, advocates, and other partners to serve on the task force. And when we reached out to invite people, the answer was an enthusiastic yes. So we've oriented the task force and we'll start meeting with them once all of the input we're gathering from the field from events like this has been collected and summarized. The vision here is that we'll gather feedback from people working in the field of public health to find out what they can see on the horizon, to learn from them how we may need to change our organizing framework so that we can be ready for the public health challenges we'll face in the next 25 years. So we've been having a lot of conversations with people and gathering feedback during meetings and online. This is our second town hall, as Jessica mentioned, and we're really excited to hear what you think. As I said, I'm super excited about the turnout. It makes it a little bit challenging to have a discussion, but I'm really hoping that you will all have the opportunity to share your input either by raising your hand or entering feedback in the chat box and, of course, answering the polling questions. So there's a lot about what we do in public health that has remained the same over the last couple of decades, but there's a lot that has changed. The 10 Essential Public Health Services is used for a lot of different things. The field really relies on it as an organizing framework. So we want to make sure that we have the right framework for the future, and we're really glad you've decided to help us create that. And with that, I'll turn it back to Jessica.
Great. Thank you, Katie. So you can see here some of the questions that we're seeking to answer. And we're looking both for your advice and from the advice of our task force, which you'll hear about in just another moment. If you advance to the next slide. Thank you. I will turn it over to my colleague, our Director of Innovation, Rena Chipgar, to walk you through our timeline.
Great. So in taking a look at answering those questions that you just saw, and to achieve the overall purpose of this initiative, we're undertaking a series of activities, which you'll see here on this slide. We have completed an environmental scan, which I'll discuss a little bit more in just a moment. And as Katie mentioned, we're also engaging a task force that's comprised of a breadth and depth of leaders, subject matter experts, and practitioners from the national, state, and local levels, really to ensure this is a field-driven effort. We are currently in the data collection phase of this initiative and have several different mechanisms for data collection. We've engaged in live crowdsourcing at different events, collected information from a variety of different think tanks through national partner organizations, state and local partners, an online survey, which is still currently open, and through these virtual town halls, which is why we're all here today. We really want, again, to reiterate this to be a refresh that's done with the field, not for the field, and that's really why we're trying to ensure that there's broad and a variety of field participation in this effort. Next slide. So as I mentioned earlier, we did conduct an environmental scan, which is available on both the PHNCI and the Beaumont Foundation websites. And the purpose of the scan was to acknowledge the 25th anniversary of the Essential Public Health Services and its significance to the public health field by really documenting their history and the breadth of their impact. So the environmental scan consists of both a non-exhaustive scan of the literature as well as some key informant interviews that really allowed for those stories and resources to be shared that may not otherwise be found in the published literature. So it really does describe the how and why of the development and the use in the field. So we encourage y'all to all take a look at that. We really did want to highlight this history and some of the uses that were discovered through the environmental scanning process to both, again, celebrate the vast use and impact of the last 25 years of essential public health services, but also to understand what we were building on for this effort and to understand the impact this effort will have and has the potential to have on the future of public health. Next slide. So as Katie mentioned, the 10 Essential Public Health Services were created about 25 years ago in 1994, and they were developed by the Public Health Functions Steering Committee, which was comprised of national government agency leads as well as representatives from other organizations. Created in 1994 in response to the need for public health to better describe its activities to the public and policymakers during the Clinton administration's efforts for comprehensive healthcare reform. It was drafted by a working group and then vetted by the Public Health Functions Steering Committee. It serves, as you all likely know, as a description of the activities that local public health systems should undertake in all communities and are organized around three core functions of public health: assessment, policy development, and assurance. You all are likely familiar with this colorful circular graphic that you'll see on this slide right now. Health departments and community partners around the nation, in some cases, organize their work around the essential public health services framework. Schools and programs of public health teach it, and the framework informs descriptions and definitions of practice in many communities and states. The framework is also used as the basis of the PHAB domains. Next slide. And the framework has provided a roadmap of goals for carrying out the mission of public health in communities around the nation. There have been many changes, both in terms of what public health does and how it does it over the last 25 years. And several assessments, frameworks, and standards have been created to help understand and drive the field forward as a result, such as those you see on this slide: Public Health 3.0, A Culture of Health, Foundational Public Health Services, and more. So as Katie mentioned, as the public health landscape has shifted dramatically over the last 25 years, many public health leaders do agree that it's time to revisit whether and how this framework, the 10 Essential Public Health Services, can better reflect current and future practice and how it can really be used to create communities where people can achieve their best possible health. So that's why we're all here today, and I'm going to turn it back over to Jessica to get your input around how we can do that.
Great, thank you so much, Rena. All right, so we'll want you all to, in a different browser, so keep this webinar open and going, but either on your phone or your computer or a device, please go to slido.com. That's S as in Sam, L-I-D-O.com. And we're going to go ahead and pull that up on the screen in just a moment as well. You'll enter the hashtag EPHS, and this is the first way that we'll get your feedback. We're all together going to go through a series of questions. We'll do some live polling. As we mentioned, we had to change the logistics just a bit because of the large number of you on the phone. So we won't pause after each question to adjust your answers, but you will see the answers of your colleagues coming in real time. And at the end of the Slido, that's when we'll kind of open up the phone lines to those who are raising their hand and the chat box, and we'll pause at that point to dig into some of your responses just a little bit more. So let me give you just another moment to go to slido.com, make sure that you all get there, and then we'll get the fun started. All right, let's go ahead and launch the first question. and that is, what type of organization do you represent? That's an easy one. And hopefully everyone's also watching the responses. So a large number from local health departments, states, academia, some nonprofits, some students. A lot of you are participating. Thank you. Give it just another moment. All right, let's go ahead and move to the next question. And we want to hear from you about in what ways have the essential services been, or excuse me, what do you see as the emerging public health challenges in the future? And for those of you just joining the line, as a reminder, that's slido.com, SLIDO.com, and you'll enter the hashtag EPHS. We want to know, what do you see as the emerging public health challenges in the future? So they're moving pretty quickly, but I've seen social determinants of health, I've seen racism, vaping, infectious disease, structural inequalities, gun violence, climate change, aging, income inequality, preparedness, poverty, data quality and sharing, chronic diseases, governmental trust, a lack of belief in science. I saw mental health come through, rural health, population shift, vaccinations, maintaining infrastructure, housing, diseases and deaths of despair, so many at once, more on access, mental health. But fun with such a large number of people. These are coming in so quickly. You guys have a lot on your mind. That's fantastic. Suicide, competent workforce, retiring workforce, early childhood, opioids, mental health, behavioral health, financing. And we are capturing this and coding it on the back end. So don't worry if I haven't said yours aloud. Changing demographics, ACEs. So some themes here that are emerging. Globalization, access to professional resources, more on racism, funding resources, trauma-informed care. We'll give this one just another moment. And remember, for this portion, it's important that you're entering your responses into slido.com. All right, it looks like we are slowing down, so let's go ahead and launch the next question. What public health functions are essential to meet these emerging challenges? All of them. Data innovation, we've got surveillance and informatics, relationships, more on well-trained workforce, cross-sector collaboration, strategic skills, lots of data, data analysis, data surveillance, data science, funding, equity and health, qualified workforce comes through a few times, money, education, systems thinking, health and all policies, workforce preparedness, cross-sector fluency, evidence-based facilitation skills. I've seen health and all policies a couple of times, change management, more on workforce and informatics, predictive modeling, strategic planning, policy systems and environment, the ability to work across sectors again, willingness to stand up to corporate interests, AI. That might be the first time we've seen that one. Quality improvement, the use of dashboards, adaptive leadership, planning, more on different aspects of data, health equity in all policies, understanding how we take action on the existing 10. Let's take another moment or two on this one. We've got coalition building, community engagement, action learning, meta leadership, professional development to encourage innovation and experience. We love to see that at PHNCI. data sharing agreements, salaries, racial equity with heart, political advocacy, access to research, systems practice, changing practice to be more innovative, appreciative inquiry. All right, it looks like we're slowing down on this one. We'll take another 30 seconds or so, and then let's use of narrative. All right, let's go ahead and move on to the next question. Thanks everyone for participating so actively. This is fantastic. This is exactly what we like to see. All right, what one word do you see when you think of the 10 essential public health services? As you can see, this is making a word cloud. So the more of you that say the same words, the bigger that one or more words become. Framework is a biggie in the middle. Prevention and equity, also showing up as pretty large. PHAB, assessment, essential, quality, infrastructure, tedious, complex, academic, standards, old, wellness, critical, holistic, research, guidance, right, we'll wait just another moment on this one. Public Health 2.0, okay. All right, let's go ahead and move on to the next question. In what ways have the 10 essential public health services been useful? I'll give you an extra minute on this one. Requires a little bit more thought. How has this framework been useful? So some themes emerging from our word cloud. I saw something about getting leadership to do the essential work, accreditation, guides the work, standardization, competency development, communication to partners and funders, organized intervention for functions, framework, workforce development, something to strive toward, strategic planning, performance management, focusing efforts, talking points, providing guidance and standardization, a consistent foundation, helps to bring priorities into focus, comprehensive, provides a framework to structure effort, communicating what public health does, raising awareness, helping us become accountable, professionalize, breaking the elephant into bite-sized pieces. Great. A framework for success, the prevention of disease, defines public health and standards for practice, a jumping off point, consistency and standards across the nation, communicates what we do, very high level framework. I'll give you just another minute on this one. It looks like we're starting to slow down. New employee orientation. PHAB was based on it, absolutely. Guidelines for best practice, evaluation, clarifies the process, not categorical topics, teaching students, self-evaluation, calibration, workforce development, teaching, performance standards. Great. All right, let's go ahead and move on to the next question. So if it were up to you to dictate the framework for the next 25 years, would you choose one, scrap the framework and create a new model from scratch? Would you scrap it and don't create anything new? Make some minor tweaks, make some major tweaks, keep it exactly as it is? So make some minor tweaks is ahead right now, with a fair number saying keep the framework but make major revisions. 1% saying scrap it and don't create anything new. 3% saying leave it alone. 8% saying scrap it but create a new model completely from scratch. All right, we'd love to dig in on this one a little bit more, so we will in just a few minutes ask for some folks to share exact thoughts on what they're thinking with this one. And I see more of you are chiming in on this, so let's leave it open for just another couple of seconds, make sure everyone can participate, and we'll move on to our final question or two. All right, looks like we've stopped. So the 56% saying make minor tweaks, but over a third of you saying make major revisions. So let's move on to the next question. So which essential service would you recommend changing? And we'd like you to select all that apply. So all 10 are listed. If you think they should change, which ones? Be sure to hit submit after you answer. Great. 7 often jumps out as the first one. Number 5. 10 with research and evaluation. If we could scroll down just to see what the others look like. The workforce, getting a lot of the answers, as well as essential service 9. 1 and 6 as well. So I think I've seen all, if not nearly all of them, getting a fair number of votes, with the exception of the few that are saying not interested in changing anything. Scroll back up. Yep, I think I see them all. So almost a quarter of you for each of them. And then a large majority, obviously, for number 7. And again, at the discussion portion, we'll ask for some thoughts on these and exactly what it is you're thinking. All right, let's move on. So then specifically, which concepts would you change or add? So this is where you can get into a little bit more detail about what you mean when you answer the previous few questions. So give us specific thoughts. So informatics and health equity to be added. What else? Chief health strategist, equity, social determinants of health coming up. More around the public health system. Leadership principles in number 8. Something about clarifying assurance, data governance, trust building, organizational branding, informatics and data, health and all policies and advocacy, communication. More on the chief health strategist, a lot on equity, racism, public health 3.0 focus, ACEs, workforce development, so overhauling that, performance management, abortion, health and all policies, public health leadership, resource allocation, population health, and number 7, data interoperability. This is great, health and all policies, public health law, more on ACEs, technology for workforce. Domains 11 and 12, referencing, of course, the PHAB domains on administration and governance. Creating a culture of health, multi-sector work, trauma-informed care, leadership, contributing to evidence-based, broadly defining health, aligning with PHAB standards, life expectancy marketing, We'll let these go for another moment or two. Starting to slow down. We'll give it just a minute. Technology, linkage of big data, racial equity, themes of justice, restorative justice, recruitment, more on workforce, behavioral health, health justice, remove number 5. A lot on that number 7 there. Prevention, okay. Population health and systems, and keep number 5. Got some differing views here. That's always great. Redefine enforcement regulation as cultural humility, reducing victimhood, big emphasis on primary prevention, climate and health, limit the number to a smaller number, policy systems and environment. Got some back and forth and some strong thoughts on number 5. Maybe we'll talk about that a little bit in just a minute. Rural access, the role of public health and transformation. All right. Ethics. Give you just another minute on this one, so be sure to participate if you haven't had a chance just yet. Policy development, community engagement needing updates. Emphasis on policy level and systems innovation. Power building and following the community lead. Income level, collaborating with community organizers. A few more thoughts on ethics. Implementation of all plans. Power mapping. All right, that was our final question for you. So I'll thank everybody who participated in the Slido live polling. It's tremendously valuable to us, not only the quantitative information, but as we mentioned earlier, we are qualitatively coding it and taking all of the feedback very seriously. We do have about 30 minutes left, and this is where we get to hear from you even more. So we'll do that again in 2 ways. If you would like to speak verbally, please raise your hand in the little box on the right-hand side of your screen. We'll then call on you one by one, but you will need to have entered your PIN. So make sure you've entered your audio PIN if you intend to speak verbally. You can also feel free to type in any questions in the questions box, and we'll read those aloud and answer those as well. I have a question for you, as I don't think, scrolling any hands raised just yet. So I'd like to ask a question, which is for those of you who said to scrap the framework and make major revisions. I'd like to know what you had in mind. What do major revisions mean or look like to you? So if you could raise your hand if you'd like to answer that question, would love to hear a little bit more. Don't be shy. Not seeing any hands just yet. Let's go to see if there's anybody in the chat box who wanted to answer that question. So for those of you, again, who said making major revisions, what is it that you mean? What is it that you had in mind? Would love to hear some specifics on that. All right, and if nobody wants to answer that one, perhaps we can go to the question or the conversation around essential service number 5. There was a little bit of back and forth on that in the Slidos from some of you who said get rid of it, some of you said keep it. I think at least 1 or 2 people offered us a suggestion, although I don't have that on the screen in front of me any longer. Does anyone want to talk about essential service number 5? quiet today.
Hey, Jessica, this is Travis. Looks like we do have 3 hands raised. I'm not sure if they're going to address your current question or if they have another question, but just want to make you aware we have Annie, Seeger, Catherine, Magnus, Rex Arthur, and Thomas Frank.
Great. Those actually aren't showing up for me, Travis, so if you could go ahead and call on those folks one by one, that would be great.
Okay. Annie, I'm going to go ahead and call on you. So you should be unmuted.
Thanks, Travis. Can you hear me all right?
Yes, can hear you perfectly.
Yep, fantastic. Well, hi, I just wanted to say, you know, one of the things I'm really interested in is understanding how the Essential Public Health Services framework kind of interacts with the other frameworks that are sort of out there in the field right now. And I know, you know, for me and for the states I work with, one of the challenges is that you can't cost the framework. You know, it is not super, I don't want to say it's not relevant to a policy audience, but it's hard to communicate to a policy audience. And so to me, it's sort of understanding what is its role among the many kind of public health frameworks out there, and how could revisions align it so that they're not competing frameworks and rather they each have their own role. Certainly, I think EPHS has a really important role in informing quality standards and informing the PHAB standards, but that's why I said major revisions.
Thanks, Annie. And I will presume that you're talking about the Foundational Public Health Services as one of the alternate frameworks that you're referencing. And it was really interesting when we started this work to look back at the history of the essential services. And Rena gave, you know, a very brief overview, but there's much more in the environmental scan, and many of you know it. But one of the things that we're interested in doing is in the spring, putting out additional alignment documents, because each of the frameworks, whether it's the essential services, whether it's PHAB standards and measures, or the foundational public health services, they do have distinct roles and different purposes, but I think sometimes that can get lost in the mix when the field just sees, whether it be the national level or from feds or foundations, multiple models being discussed without a lot of clarity on why multiple things exist. So we do intend to put out some alignment documents to help people understand the difference. One of the major differences with the essential services as they stand is that they're not limited to governmental public health practice in the same way that the Foundation Public Health Services. So that's just one little nuance there, but it's a great point in question and nice to hear from you. Travis, who's next?
We have Catherine Wangness. I'm going to go ahead and unmute you if you want to go ahead and ask your question. Sorry about that. I went ahead and unmuted you. If you want to go ahead and mute either the computer or phone you're on, we're just getting some feedback.
Computer.
All right. Sorry about that.
Catherine, we'll come back. Sounds like you've got your computer and phone speakers on, and we can only talk to you through one of them. So let's move to the next person, and we'll come back to Catherine in just a minute.
Yep, next person is Rex Archer. I'm going to go ahead and unmute you.
Everybody. Hello, everybody. I wanted to comment on a couple things. One, particularly at the local level, policy development varies according to different state systems. In some cases, local health departments are really not allowed to do policy development because of state or local statute. But the flip side is that I think policy is the most important thing that we actually do in public health. So that becomes a challenge where some people aren't able to do it. The other concerns that I have in regards to strengthening things is we are not very effective at building our trust and brand with our public across the nation in regards to public health. And the organizational branding and marketing kinds of things were not really any place in the essential services to speak of, so we kind of moved them in under PHAB standards under Essential Service 3, but I think that needs to be explored. And then the final piece is the community mobilizing, including and up to initiative petitions or other mechanisms to get the community to move issues forward on health equity and social determinants of health. And I think all three of those need considerably work to strengthen and move us forward.
Thank you so much, Rex.
I'm going to go ahead and unmute Kim Frederick. You are now unmuted.
Hi. I just wanted to say that I think the framework is essential to describing what public health does. And I've used the framework to express that to the community that wonder what we're doing. I think it speaks well to the various core functions that we have. And I guess I'm going to sound very old now. I have seen many times where young workforce has come in and changed things because they thought maybe it could be better and lost a lot of what was solid foundation. So I was very pleased to see that tweaking it minorly opens it up to refreshing it, revising it. But I hear an eagerness for the 34, 36% that wants to just rebuild the wall. And so I guess I'm just expressing that I hope that you think long and hard when you do make the changes to the framework. Okay.
Thank you so much. And I'll pause to respond to that and a few other questions that have come into the chat box, and then I'll turn it to my colleagues to see if they have anything to add. But I will say we certainly at PHNCI and the Beaumont Foundation recognize the weight of what we're doing. This framework belongs to everybody. We are not claiming it as ours. We all just feel that it's been 25 years. It's worth revisiting and making a decision about whether revisions are needed based on what the field says. So to that end, we have convened a task force that will be advising us. There are local state practitioners, there are academics, there are federal partners, there are national organizations that represent constituencies. So it's a great group from the practice and other aspects of the community. But that's really also why we're doing these events. So we didn't go into a ton of detail in our work plan, just in the interest of time. So we do have 3 virtual town halls, of which this is the second. We have 2 town hall sessions at EPHS. We're meeting individually with a number of different organizations. So for example, the board of directors for NACCHO, for the Public Health Foundation, the Big Cities Health Coalition. We're meeting with the Beaumont Foundation's 40 under 40 leaders in public health. We had a call with the ASTO state health officials. We'll be talking to their alumni. We're talking to the NACCHO past presidents. We're talking to one of the councils with ASPPH. APHA has pushed this out through their network, and we're trying to get a lot of responses through our online survey. So a few people have asked about kind of who are the decision makers and how are we going about doing this. I just want to assure everybody on the call that we're not doing this in a vacuum, and we're not doing this based on our own thoughts and opinions, but rather really trying to understand from the field what the field needs. And we do understand that any changes or revisions do have implications for practice. They have implications for health departments that have chosen to organize themselves around this. They have implications for curricula, whether it's for graduate students or undergraduate students. So we really don't take that lightly. And just want to assure you all of that. Let me turn, Katie, to you to see if you have anything you wanted to add to that, or other colleagues on the PHNCI side as well.
No, I just would reemphasize what you're saying, and my comments earlier about how excited I was to see all the participation on this. I hope this isn't frustrating for you all, that you don't all have a chance to speak up, because we won't have enough time for everybody to speak verbally. But I want you to rest assured that we are capturing all of your feedback in the Slido, all of your feedback in the chat box, all of your feedback in the questions box, and this will all go into the process. I mean, this is the crowdsourcing of the data, and we really value your opinion and appreciate your participation.
Let's try to go back to Catherine, who had her hand raised before, and then after that, we'll move to some additional thoughts and questions that have come in through the chat box. So can we unmute Catherine again?
Hi,
Catherine, go ahead. You're unmuted.
Hi, this is Catherine. Can you hear me? Hello?
Yes.
Okay. I realized I forgot to hit a button, and that's what was causing the feedback. So thank you guys very much for this discussion point. I actually opted for the minor tweaks, not the major overhaul, but I think the big piece, there's been a lot of discussion since my thought, but I think the really big piece is really a lot of clarification. 25 years ago was before I started working in public health, but not much. There's been a lot of work around this. We've learned a lot. And I know you guys are definitely taking this well, and I think it's really clarifying, how the changes have changed what we're doing, how we are approaching things, how we're looking at things. I mean, email, electronic communication is definitely a bigger piece. So I really think that, my vote is definitely for the minor tweaks and clarifications. It's really about language and expectations that are driving. It's not just our expectations in the public health field, but also the expectations of our citizens, our constituents, the community. Those expectations have changed from 25 years ago, and I think that's something we also have to really look at is, they're able to easily access information, and it drives and changes their expectations, and I think that's something we kind of have to keep in mind also. And for number 5 with policies, I really feel like we do a lot of shaping policy, but not necessarily creating. Well, I don't know how to phrase that properly, but we're involved with a lot of shaping. It's definitely a confusing piece on best approaches. So I don't know that I had a question in there. It was more of a comment, but thank you.
Thank you for sharing. Okay, we'll do one more hand and then we'll move on. Veronica Moore, looks like you have your hand raised, and then I'll turn it over to Rena to moderate some of the chat box.
And Veronica, you are unmuted.
Veronica, are you there? You may need to unmute yourself on your phone as well. All right, well, let's move on to the chat box, and perhaps we can try again on the line in just a little bit. Rena, let me turn it over to you.
Great. There's been a lot of great comments and questions that have been coming into the chat box, so please keep them coming. I'm going to start with a couple of the questions we've received in the interest of time. So Jessica and Katie, one question for y'all. How does the current 10 essential public health services compare with those in other countries?
Katie, do you want to start, or would you like me to?
I mean, I don't have too much to say about that, only that I am aware it is often used when CDC works globally and is helping a developing country build their health systems. They sometimes use the 10 essential public health services as a reference to kind of talk about what the services ought to or could look like in that country. I don't know that much about more developed countries, and I don't know if you do, Jessica.
Not the specifics, although it's an interesting point in terms of looking into that. Obviously, there'd be some natural differences. One thing we have looked into is with PAHO and the World Health Organization, and having undergone a similar process to consider revising and look to them to learn how they went about doing that. So that's the one kind of connection point that we have there. But we're really looking internally at the U.S. system on both the history, how it came to be, and how it's being used domestically as opposed to internationally. But if y'all have examples, please send them our way.
Great. The next question we have is, what are some of the factors that may have influenced or hindered adoption or policy change around the 10 essential public health services currently?
I'm not entirely sure I understand the question. If it's about inhibiting the adoption of the essential public health services framework, I think I need more information on what does that mean. I mean, what we do know is that, you know, schools are teaching this. We know that health departments often organize themselves around it from an organizational structure standpoint. Certainly PHAB standards and measures are based on the essential services with the additional two. So I think it's been very widely adopted, and that's what we found in our environmental scan. I think what we've heard is that it doesn't, you know, currently, given that it came to be 25 years ago and that so many things have changed, as Katie pointed out at the start of the call, people are just going beyond it now. So I don't know that the characterization of it not being adopted is resonating with me in terms of how the question is asked, but it could be that I'm misunderstanding. So Katie, I don't know if you have any thoughts on this, or maybe are viewing this differently.
No, I don't have additional thoughts.
Great. The next question from the chat box we received is, can you describe some of the explicit or non-explicit values informing the revision process for the 10 essential public health services?
Sure. I mean, so we started by, I think, really, as Rena, you said at the beginning of the call, doing this with the field. So I think number one is we're not doing this as, you know, national organizations sitting in Washington, D.C., thinking that we know what the field needs or wants. The entire process was developed with this kind of crowdsourcing mentality. And I think one of the reasons why the Beaumont Foundation chose to partner with PHNCI is because of our track record, not only at PHNCI, but with PHAB, our parent organization, of being able to do that. So I think that's kind of first and foremost, is doing this with the field, kind of practicing what we preach when we talk about, you know, community engagement and trying to engage our public health community in responding to this. I think to the rest, you know, we are really just kind of kicking off with the task force, having oriented them to the work. But I think those are some of the things that we'll be discussing based on the feedback we're receiving. By and large, we want to make this useful and have it be something that the field needs and something that's going to be lasting. So beyond that, I think the rest of them will really be based on what we're hearing. And we are starting to see some themes. I think you've all seen that with some of the just brief scrolling through of the answers to the live polling, that certainly there's some disagreement, but we're seeing some themes in terms of what people think is missing or how things perhaps need to be clarified. So I think more will emerge as we continue to kind of crunch the data both quantitatively and qualitatively.
Great. Another question we've received, and we've received a few that ask kind of similar questions. So generally, how is this initiative and this refresh approaching public health or non-public health folks outside of kind of the direct public health sector, and how can that input be used to provide insight into the work that public health does?
We've largely decided to focus on collecting feedback from the public health sector because this is a framework for use by public health. One of the things that was important to us, though, is that it communicated well. And so we have engaged a communications firm to help us think through the words that we use, because we know that words matter. And as many people have indicated on the call, the framework is often used as a communications tool when working with other sectors or with policymakers. So we think that's important. And we're not opposed to feedback from other sectors, but we think it's most important to be collecting feedback from the public health field itself, as this is a framework for the public health field. So we have been intentional about not going out of our way
to solicit feedback from beyond.
All right, we're going to go ahead and try and have Veronica ask her question live. I went ahead and unmuted you, but it does say you are self-muted, so if you can unmute yourself on your physical phone and ask your question, that would be great. All right, looks like we're not hearing you, Veronica. We'll go ahead and, if you just want to type in your question, we can go ahead and try and answer that through there. Looks like we also have a question from Heidi Klein. I'm going to go ahead and unmute you if you want to ask your question live.
Oh, hi. It's actually, so one of the things that I'm super curious about, and it goes back to a previous comment about sort of the not throwing out the baby with the bathwater, and recognizing sort of what is new now that actually calls upon the reinvestment in the old. And you will see from some of my comments before that what we're really struggling with here in our state health department is having adequate investment in our surveillance and information technology systems for data. And so I'm just wondering to what extent, as you are thinking about any kind of updates, you're taking into account sort of the incredible change in demand for real-time data, and how that connects or doesn't connect with how public health is able to collect and analyze data, and not just put out data that hasn't been effectively analyzed.
Well, I can say we haven't had those conversations yet because we're still collecting the feedback. So while we're looking at what's come in, we're kind of waiting until our data collection period is done to really engage in any substantive conversations about what that means and what to do with it. But I think we have seen quite a bit come up in the comments and the crowdsourcing regarding data and regarding all aspects of it. So data sharing, data analyzing, workforce trained, to collect and analyze data, having that ability. So it's, I imagine it's going to be a big topic of conversation when we get to that point. So we do have only another minute or two. I do want to let folks know, so there have been a lot of comments coming in through the chat box, which is fantastic and exactly what we hoped you would do. In the interest of time, I think mostly it's comments, but I think there are some questions in there as well. We certainly don't have time to get to all of them today, so we will go back and look through all of those and perhaps develop an FAQs document to answer some of those questions that have kind of concrete answers. But we, again, as Katie mentioned, as I mentioned, are taking all of this feedback, whether it came in through the Slido, verbally, or through the chat box, and it's going into our data analysis and number and qualitative data crunching that will be presented to our task force, which speaks to next steps early in 2020. So they're meeting in mid to late January. And then we'll go ahead and put out a potentially revised framework in early 2020 for public vetting and for additional feedback. So not only are you having the opportunity to provide us with your feedback now, but again, once a theoretically revised framework comes out in early 2020 before it would be finalized by June. So please encourage your colleagues to join us for our November town hall. If you're going to be at APHA, please stop by our sessions. We have an industry expert theater in the exhibit hall on Sunday afternoon, and then we have a concurrent session on Tuesday morning. We also do have the online survey open, and then again, the town hall in November. So please feel free to reach out to us with additional thoughts, questions, and to encourage your colleagues to do the same so that we can really ensure that everything we're doing is informed by all of your thoughts. With that, before we disconnect, let me turn it over to Katie to see if you have any final thoughts or closing comments for the group.
No, I just want to say that I am sorry we weren't able to answer all of the questions. I do hope that you will find the answers in the frequently asked questions, but I also hope that you will reach out to us directly if you're really looking for an individualized answer that you don't get. We certainly appreciate your participation, and we especially appreciate some of the tougher questions that you asked that may cause us to really stop and think about how we're going about this. So thank you all.
Great. Thank you, Katie, Rena, Travis, and thank you all for joining us, and you may now disconnect.